The heat health emergency is still in effect in Philadelphia through the end of the weekend. That, combined with the air quality alert, is increasing the risk for heat-related illnesses. Health reporter Stephanie Stahl joins us with more on what's already been a very busy week for emergency rooms.
It has for sure, Jessica. The CDC just says that this week there were the highest number of heat-related emergency department visits since 2021. And one South Jersey woman explained what happened to her.
And I was not aware of just how warm it was. I just continued to water my plants.
Monica Procopio, who lives in Chemung, New Jersey, learned just how dangerous being outside can be.
I started to feel lightheaded and a little disoriented. That concerned me. It continued to get worse, actually. And I ended up getting sick.
At the emergency department, she was diagnosed with heat exhaustion and treated with IV fluids.
It was very scary because I became disoriented.
Doctors say it can happen quickly if your body temperature gets above a temperature range of 105.
Most of our cells have proteins and enzymes and channels that they only work in a certain range. And once your temperature gets outside that range, you get into trouble.
Dr. Sacchetti with Virtua, Our Lady of Lourdes Hospital in Camden, says the emergency department is equipped with things like fans and ice to quickly cool patients down.
But it works very, very effectively if you can pack them in ice.
The combination of heat now added with the humidity will be especially dangerous for people in high-risk groups.
The problem is, as the humidity goes up, you can sweat, but you can't evaporate it because the air's got too much moisture in it, so you can't sweat. And when you can't sweat, that's when you really get into trouble.
Dr. Sacchetti says so far there have not been a lot of patients with heat-related emergencies, but that's expected to change.
As this thing progresses, we are likely to see a little bit more of an increase in these folks with heat-related emergencies.
And doctors say it is especially important to check on elderly neighbors who don't have air conditioning. They are at the highest risk for heat-related emergencies. So we really need to take it easy, take care of each other, and drink lots of water.
Yeah, absolutely.
Really important.
Even when you're not thirsty.
Absolutely,
so,
yes.
Thank you.